Dr. Daniel here. Let's talk about dry eye. This is one of the most common topics in my clinic. Dry eye is a chronic, frustrating, but treatable condition that pretty much everybody has who comes in the clinic. They just don't all realize it. So dryness can be as simple as the fluctuating blurriness you may experience when you stare at your phone, or you read for a long time, or look at a screen for a long time, focusing on a task. We do not blink as often, and you may find that things start to get blurry and you have to blink a few times to clear it up. That's dry eye, and it has a huge spectrum of disease, and so it causes fluctuating blurriness, light sensitivity. It can give you lots of different irritation symptoms, including feeling like there's sand in your eye or an eyelash in the eye, itchy, scratchy, burning, sometimes more nonspecific aches, but not as often. It's usually the foreign body sensation. And it comes and goes, and it may be worse at certain times of the year, and it may overlap a little bit with allergies sometimes. If there's a more prominent allergy symptom, then really pay attention to the itchiness. If the itchiness is predominant, there may be some allergy involved. And certain medications can make it worse. Glaucoma medicines, for example, can exacerbate dry eye. Some systemic medicines can do it as well. Eye surgery makes it worse, including cataract surgery. Really, any eye surgery can flare it up for a while. So you really want to have it under control before you go into a procedure. And again, it's treatable. So I've got a handout that I wrote myself that runs through the over-the-counter treatments, starting with hydration. Just drink water. It's important to stay hydrated for many reasons. Lubrication is probably where most bang for your buck's going to be. So it sounds confusing because often the eyes are watering when your eye is dry. Your body's trying to fix it because the eye is irritated. And it sounds confusing to put water on your watery eyes, but if you think of it as if we're almost trying to reset things, it does help. So in the eye drop category, there's preservative-free or regular tears. I would go preservative-free if you're doing more than 4 times a day, or if you have sensitive eyes. They do cost a little bit more. But there's tears, there's gels, which are a little bit thicker, but are very effective and last a little bit longer. And then there's actually ointment, which you can use usually at bedtime, but you can use it during the day too. Comes out almost like a little salve or Vaseline, and Refresh PM or Sustain Nighttime are examples of 2 products. But you'd pull down your eyelid, just put a little line across, or take a little bit and rub it into your eyelashes before bed. Definitely doing this after any glaucoma medicines in the evening. This would create a barrier otherwise that would affect the medication, so you don't want to do it before a medicine drop. And generally speaking, with medicine drops, about 5 minutes is fine between the medications, but you want to separate drops so you're not washing one out with the other. So lubrication is going to be the most important thing. And if you're symptomatic with dry eye, I would be starting at a minimum of 4 times a day of an artificial tear, and then kind of going from there, depending on what you need. But be patient. It can take time, weeks, and sometimes many months to get this under control when it's really bad. Warm compresses can help. A huge part of dry eye involves the oil glands that are in your eyelids. There's glands that open right near the base of your eyelashes. They can get clogged up, which would be a chalazion or a stye you may have heard of. But those glands should be making more of an olive oily fluid that keeps your tears from evaporating really quickly. And so many of us have clogged glands that are not flowing. It's more like toothpaste in there. And so heat can help that flow better. A warm compress, I recommend a beaded eye mask, not a wet washcloth or a tea bag. Those don't hold heat well enough. But one of these masks, or sort of a poor man's version, is a sock filled with dry rice. And it does smell kind of like a sushi restaurant, but it does work. And you can put these in the microwave, the beaded mask, maybe 20 seconds. The rice, you'd have to do a little bit longer. Obviously, you don't want to burn your skin, but about 5 minutes, once or twice a day. After you just close your eyes, put it over. It feels like a spa treatment. It should feel nice. It's a good sign if you're blurry afterwards. If you get blurry, that means those oils have expressed themselves, and you want to just forcefully blink your eyes, kind of on and off for maybe 30 seconds or so to really encourage the flow of those oil glands. And that's not something that's just going to bang, all of a sudden I feel amazing. But if you do that over weeks, you may notice some very significant improvement. On that topic, high quality fish oil, and there's a particular brand, I don't have a conflict of interest with this. One of my colleagues kind of nerded out on this and found that this was the best product, but it's called PRN. It's a very high quality fish oil that's designed to help these glands, and it does help the rest of your body as well with anti-inflammatory properties. But I am a fan of that medication, and especially if you get the clogged oil glands, that can help loosen them up. The eyelid hygiene, there are some wipes that you can get. For example, I use one called Optase, or there's a spray, various options for that. We carry these in the optical shop. And just kind of close your eyes, and it's almost, the wipe is like a makeup remover. You just gently scrub the base of your eyelashes. You can alternate this with the spray. I used to say doing these every day, but you don't have to do them every day. Per one of my colleagues who specializes in dry eye, you can do alternate them, or do one and wait a day or two before doing it again. But that helps clean off debris and bacteria and stuff at the base of the lids and keep things clean. Those are kind of your basic options. The next level, and there's a whole nother level of more advanced treatment, we can do prescription dry eye medicines. Restasis, for example, or things in that category that have anti-inflammatory properties. They do take a month or so to kick in, but those are great options for long-term management. You do them twice a day. They're kind of like a glaucoma drop. You're not going to be going up or down on the frequency of these like you would with the tears, but you're just going to lock them in about twice a day and use them continuously. There's a BlephEx procedure that I've had done before that's almost like a Sonicare toothbrush with a very strong cleaning solution that they numb your eyelids. A technician does it, and it just scrubs the base of your eyelids and get things way cleaner than you could have otherwise. On that topic, there is a little tiny parasite, don't let this creep you out, called Demodex. And it is surprisingly common. I won't give you the stats on patients as we age, and it sits right at the base of our eyelids. You cannot feel it moving around, so don't let that creep you out. But it definitely impacts dry eye, and if you have a significant amount of them, we'll comment on that, and that can influence the oil gland function. And so treating those can involve that procedure I just mentioned, as well as tea tree oil applications. That Optase wipe I mentioned has some tea tree oil in it. So the Demodex can be something that we hit aggressively as well as a next level treatment. And then one of my colleagues has a whole nother set of skills. And usually when we get to the topic of punctal plugs, which we can do plugs in the eyelid that impact the drain that takes the tears into your nose. So you're kind of partially plugging that drain so the tears stay on the eye longer. That's actually the only intervention I really have that doesn't give you homework and more stuff to do. It's very easy to do in the office, takes about 30 seconds. But one of my colleagues is a specialist and has a lot of other treatment options. And so I'll let you know if we're at a point where I think it makes sense to transition to a specialist for those evaluations. But yeah, tough condition, huge spectrum of disease, manageable. For those of you who are on the struggle bus, this is a treatable condition. Be patient, it takes time, and we will always work with you on it. So thank you.